You're right. That opening does give you fire. Thank you so much once again for joining me on One Take Live with Monica May. I do want to remind you to follow us on Facebook, please, if you will, and just click and share this video. We really want to get this information out, and we're now on Spotify. Oh, I'm so proud of the way we're moving, and we're doing this all with your help, and I appreciate that. So, I want my brothers to get ready for something. There's a new community coming to town just for you. It's been established already. You'll be able to come out of the barbershop, and my guest has a name for that philosophy, all of that stuff that you all talk about in the barbershop, and share the truth about your health and a whole lot more. My guest tonight is Clarence Reynolds. He is an award winning journalist, a broadcast professional, and tech entrepreneur. He's worked as a news anchor for the NBC and Fox affiliates in Atlanta and Indianapolis as well. And he's currently a contributing editor for London based Telecom TV. Now, Clarence is the co founder and CEO of the Black Men's Health Alliance. It's a 501c3 nonprofit organization that drives conversation that addresses the unique health challenges faced by Black men. And they're not only talking about health and in one perspective, they're talking about everything. So, Clarence, how are you? And thank you so much for joining us tonight on One Take Live.
Monica, thank you. It is wonderful to get the word out and to talk to you. I appreciate the opportunity and looking forward to having this conversation.
So when we talk about that barbershop, I love what you call it, because when men go to the barbershop, they feel free there. They feel like they can bring up anything, talk about anything, and conversation basically stays right there. But in this community that you're developing, it's not necessarily just barbershop talk.
No, no, and you're right. I call it barbalosophy. It is information and all kinds of conversation that is not based in any fact often, that is full of opinion, that's delivered as though it's fact.
Mhm.
And it is, fun when, we're just talking about the fight or we're talking about, the game or whatever it is. But when it comes to our health, we really need to rely on trusted advisors, trusted voices. And that means medical professionals, that means people who are in the fields working that can help us to improve our health and help us to elevate health as a priority in our lives.
Mhm. What was your premise for doing something like this? Just beginning a whole new community. This is a pretty new concept, huh?
It is to have an organization that does a couple of things. First of all, it is we wanted to make a holistic community for Black men. So not just about what you eat, not just about exercise, but really everything. So that we're talking about physical wellness, mental health, nutrition, and fitness. And really, we're also going to talk about how microaggressions and racism, both the individual racism as well as structural racism that we know exists. We're part of it, and how that all works into really creating barriers to us being our best selves. So we
Mhm.
wanted to create an organization that was holistic and also built community. And why? There's a couple of reasons why. First of all, I am the recipient of the love, protection, advice, mentoring, friendship of lots of Black men. From
Yes.
my father, stepfather, brother, uncles, cousins, all the way out to friends and colleagues who have really driven my life. So, in that intro that you did, that is often interesting for me to hear because I never put the whole picture together. I'm where I am because of these Black men who believed in me, who pushed me, who encouraged me, who protected me, and they are the reasons why I wanted to give back. And this was a big part of it.
Mhm. So we've got four pillars, it sounds like, that we're going to be discussing. And I say we, I know that women are not necessarily going to be a part of it, but we can at least encourage our men to join in this community, huh?
Absolutely. I had a question that threw me off, Monica. I, for the first time, had someone say to me, a black woman said, "What
Mhm.
can black women do to help and help this effort, help to get our men involved in taking better care of themselves?" And my answer was support. We need your support on this journey. But the reality is, this is about self preservation. This is about quality of life. This is about legacy and what
Mhm.
we leave and how how our children see us as somebody who cowered because of a doctor or somebody who leaned in and took better care of themselves and ate better and exercised. How
Mhm.
did they model that? So we need your support. We need Black women's support,
Yeah.
but we really, this is, as I always say, it's not our fault we are where we are, but it's our responsibility to lift ourselves out of
Mhm. I think that another pivotal way for women to be involved is to do like I do. Be a pain in the you know what when you see your man struggling with something that's going on and you can tell. You know him from head to toe. And if you see something that's out of place, say something. And not only say something, do something. You know my situation that I just had. My husband George spent time in intensive care. Could it have been prevented? Probably not. But could it have been worse? Yes. If he had not finally given in and allowed me to take him to the emergency room, we still wound up in intensive care, but at least it wasn't as bad or fatal. Okay, because we did get the doctor's orders just recently that said, had you not gone, this might have been fatal. So, sisters, tonight, I want you to make it your dual role. Even if you're not married, you're around men who you know. And if you see something different, please say something and don't stop until they act on it. So, if you want to know how women can help, be a pain in the you know what.
it. And George is lucky. He has a Monica. Not
Yeah.
everybody has a Monica.
Yeah.
Some of this we have to, as men, say, how am I going to live this life? How am I going to go out here in fear, in pain, slowly sliding down the hill, or am I going to take the proactive measures to make
Yeah.
sure I'm healthy, I'm strong? And I wanted one of the things that Monica and I've prayed about this and I thought about it. One of the other reasons why I started this organization, and it shocks a lot of people when I tell them privately what it is. So now I'm just going to tell people because the reality is what the
Tell me.
reality
Tell us. Tell us.
you know, one of the things that got me really thinking about how to reach out to Black men to help them to improve their health, to be proactive,
Hmm.
was the Ukraine war.
Okay, tell me how.
I watched as Russia invaded Ukraine and how the men of Ukraine, lawyers, accountants, artists, cab drivers, all jumped in to defend their country.
Hmm.
These are people who did not have, Ukraine has never had a big army. Ukraine is for, and it's hard to imagine now, but that is a country that was pretty wealthy. If you, for people who've been to Ukraine, they will tell you it is one of their, Kiev was one of their favorite places because it is was really a fantastic place. Wonderful restaurants, wonderful stores, and all your favorite stores, the stores that you love here in this country, they're all there and bigger. The Louis Vuittons and all the other. It was a really fantastic place. But those men were healthy enough, were 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 present enough to be able to defend their country. And I said, hmm, if somebody came to us as a community, would we be ready? Would we have the ability? These are accountants and doctors and lawyers who are now firing ammunition at an enemy. They jumped in what was supposed to be a real quick and dirty war. Has turned out they have decimated an army, a physical army of people who were in the military, who were poorly educated, in bad health, and could not they still are fighting this war
Mhm.
against civilians, mostly civilians. So when I saw these men who jumped in, they only jumped in because they were ready. And you know what they used to say on the block, Monica? If you
Mm.
stay ready, you ain't got to get ready.
Okay.
And not that I'm saying that that's ever going to happen, but where are you when it comes to, and I'm talking to black men, where are you when it comes to your readiness, ready for whatever it is, and
Mhm.
being able to defend yourself, your family, whatever, or just take good care of your family, and being the light of this is how we roll. We eat well, we exercise, we
Mhm.
do all the things that you're supposed to do, and things happen. But when they're not as bad because we've been doing the work ahead of time. We've been living right. So, as my grandmother used to say, and that is what that really was one of the things that got me started this road.
That's really interesting, and that's a very different kind of story. I was not expecting that. I thought you were going to say the typical thing. Something happened to my dad, and it did happen to your dad,
Yes.
and preventable things. I
Yeah.
thought that's the storyline you were going to give me. Had no idea that you would take it in that direction, and that's interesting. However, I think that developing the community of men that you're looking forward to having with the Black Men's Health Alliance, that will be community enough that you all can make decisions amongst yourself. You can boost each other up. You know, you mentioned something earlier, Clarence, about health disparities. Well, one of the reasons we are in such a disparate situation is education and lack thereof. And
Yeah.
then by the time we get into the office, we may not have the right lingo. We're fearful. We've always been fearful of doctors, but when will we get over what has been done in our past? And I understand it totally. But
Yeah.
in order for us to really survive this life, we've got to move past that. And we have got to start fending for ourselves and taking better care and going into that office and asking questions and making sure we understand what they're saying. And then
It's
coming in,
exactly.
you prescribe medication, take the doggone medication.
It helps, and you're right, you're absolutely right. My father died of complications due to diabetes, and this wasn't, most of us know who have had family members that have had or dealing with living
Mhm,
with diabetes. We know that doesn't, you don't wake up one day with it. It
mhm,
is something that is progressive. You know it's coming. The doctor will let you know. You see the changes in your body. And my father, career military man, just ignored the advice of his doctor. He went to the doctor. He had the VA benefits, so that kind of access was not an issue. But it was him listening to the doctor. His lifestyle was more important than making the changes, and in the last part of his life was a diabetic amputee. And again, unnecessarily, we
yeah,
are disproportionately impacted by things that are treatable. And one of the other things, if you read the National Institutes of Health, actually does a state of Black men's health every year, in for Black men in America's health every year, and it reads like a horror novel, and only because
yeah.
we are dying of preventable diseases, dying of things that could have been headed off, that things that grow slow, prostate cancer, slow growing,
Mhm,
colon cancer grows slowly. It's not like lung cancer where you get the 6 month diagnosis. This
yeah.
is these take years, so you have to ignore symptoms in order for you to get to this point where it becomes life threatening. And being able to really just elevate health in Black men's lives, change that number, because right now we're at the bottom and or top of all the bad lists, and that's
Mm.
that's a problem.
So tell me how this community will work. The Black Men's
So
Health Alliance, the community you are developing now.
so it's an event-based organization. So we have right now we have three different programs that will take men on this journey and
Okay.
journey together. So one of the programs is the Know Thyself program, which I'm very proud of, and it's really about the annual physical, and it's about becoming a good customer, because that's all you are. When you go into a doctor's office, it's no different than you going into a restaurant. You are the customer. You place the order. You say, this is how I'm feeling. This is where things are going wrong. They are to facilitate what you have, what your priorities are. And we come in this helpless, I don't know anything. I'm just going to let whatever happens happen, or we're afraid to hear what happens, as if we, if not hearing it, will make it go away. But the
Mhm.
reality is, being a good customer is what that annual physical is about, because you walk in and you're, how are you doing? Well, doctor, here's my list. Let me open my phone because I had some notes. I want to ask
Good,
you. I want to have some
good.
questions here because I've been on this medication and it's not, and I'm still having this issue. This is your opportunity to be a good consumer, because that's what it is. You're paying for it on some level, even if you just pay the copay to get into the doctor's office. You are the consumer, and that's building better consumers. So that's one thing. The other things that we're doing are the group coaching, which is really important, because we are bringing in African American male wellness coaches to take us through a journey, to walk us through the process of getting rid of those barriers to whatever is our thing. Whether it's, I want to exercise, I don't really have the gumption to get up and do it.
Yeah.
If it is, I need to eat better, but I don't have the time to cook. I don't have the wherewithal to eat right. How we can do those things well. So the coaching becomes very important about how we remove the barriers. And then the final thing is our house calls. House calls is really just sort of like, we're going to get together as a group and we're going to listen to a professional talk about what it is they do and how we can get better with their knowledge. So this is to replace that barbershop and that barberosophy, is to talk to professionals in mental health, and how we deal with the things that we seem to be drowning. For so many men tell me they're drowning in all these emotions, nowhere to put them. And
Yeah.
how do we handle that? Well, it's not going to be drinking it away. It's not going to be, going to the barbershop and
Yeah.
as
Yeah.
Beyonce sister Solange says, you try to smoke it away. You try,
Mm.
you
Yeah.
can't do
Yeah.
it. Because you end up with cranes in the sky and always under construction, instead of when will you finish that house. And so we need to get professionals in, and so that's what House Calls is about. So it's really a series of events that you can participate in, that Black men will be able to be able to say, hey, this is my ministry right here. I need to go and hear this from this professional, this dietitian, this nutritionist, this fitness person. I want to come in and learn. So that's what it's all about. So that's how the community will work.
Okay. Once again, you're listening, watching all of that good stuff to One Take Live with Monica May. I thank you again for checking us out on Facebook. Please follow us there. And then if you have this video, please, please, please share it. That's the way that we get the information out. Check out our YouTube channel as well. And of course, we're on Spotify. Again, it is One Take Live with Monica May. The CEO of the Black Men's Health Alliance is our guest tonight, Clarence Reynolds, and we're talking beyond the barbershop and getting some real information. There will be doctors. In fact, as the CEO, one of his partners is a doctor. So let's talk about him. And how did you guys get together?
Yeah, so co-founder is Dr. Brian Sykes, and Brian is a physician who is both a physician and an entrepreneur. We met in graduate school. He was getting his MBA. I just graduated in August, got my
All
MBA, and we
right.
met, and we didn't work on any projects together, but we were working in a group, sort of in a group project together, and we just started talking about what's important to us. And he is African. He's from South Africa, but has lived here most of his life. And being able to see how the differences in how African men treat wellness, and how African American men treat wellness, and sees the differences. And he actually can also, one of the things that he was alarmed by is how this U.S. and Western culture is impacting how African men are starting to see they're changing as well. And so they're starting to get lax about their health and
Mm.
about eating, you know, and it's one of those things that we sort of just bonded over that. And out of that, and me saying, hey, I've been looking for a community. I wanted to, I'm aging. I'm trying to figure out, you know, what's the natural course of aging and what might be an ailment that I need to go and see. So those kind of intersections, which a whole lot of men are dealing with, and we were talking about, you know, that there's not a place for us to. I don't want to hear from people who are outside of our community telling us about our health because we have different triggers, we have different layers of things that are working together or working against us that we have to deal with. We want to hear from people who are trusted, you know, voices that we know they understand. We don't have to translate anything here. This is coming from people who are like us. And so that's what we wanted to do, was to build this community, build this small utopia for Black men to come and hear from Black male professionals who are telling them, I understand. Yeah,
Mhm.
it's hard to push back from, you know, from dinner, like a Thanksgiving dinner, because you know you would offend your mother. Only we understand that. That's our thing. And we have to understand how to navigate that. And so that's where this community came from. Brian and I just sort of clicked. And that's where he's right now in Central America working on a project. He is an entrepreneur in the medical industry and has had a couple of exits, meaning he sold a couple of businesses. So he
Okay.
doesn't practice anymore. He doesn't really need to or want
Is
to.
he young?
And he's 55. Yeah.
He's young. He's
Yeah.
young.
Yeah.
And I'm assuming he's relatable if he's
Oh, yeah.
partnering with you. If he's partnering with you. You know, what do you think? And I know the answer to this, but I want to hear it from you. What do you think the Black Men's Health Alliance will be able to do in terms of impacting those health disparities and the health outcomes that we're looking for? How do you think
You know,
your organization will do that?
we recognized early on that this is a big lift. That there are a lot of men who have been waiting, like me, waiting for something like this. And then there are a lot of people who are going to stand on the periphery and say, "I want to do it, but you know, I'm gonna try, but I don't know if I can give up X, whatever X is."
Mhm.
And then there are people who won't want to have anything to do with it. We know that it's going to be that. But what we want to do is to elevate wellness in the minds of Black men. That it's going to work, taking care of your family. That's wonderful. That it should make you feel good. It
Yeah,
should be a priority in your life. But right behind that, if you're not there, then none of that meant anything. So you have
that's
to
that
take care of
legacy.
yourself.
Yeah, that's that
Absolutely.
legacy.
And you know, and people have overused this, but it's a great analogy because it really does work. You know, if something were to happen and you're on a plane, the first thing they tell you is put your mask on first before you help anybody else.
Mhm.
And that's what we really want to do, is just elevate wellness in the minds of Black men. So it's like, hey, I work in a 3-story building. I'm just going to take the stairs. I'm not getting in that elevator anymore. It's too long of a wait anyway. We all get to work at the same time. Just take the stairs. I'm gonna do something different. You know what? This time I'm gonna park in the back of the parking lot. It's a nice day. I don't want nobody messing with my car anyway, opening doors and stuff. So I'm gonna park in the back. I'm just
Yeah,
gonna do small things that give me a little bit more exercise. I'm not gonna drink all of this can of soda. I'm gonna drink half of it and throw the rest away. Just small steps. So if we can elevate wellness, it's those small changes that add years to your life. And that's what we know is important. And that is, as my father used to always say, he used to tell me, my father, as I said, career military, he used to
mhm.
always say, the man of the house is like the support beam. If you take away the support beam, the house collapses. And so without us, all of the things that you've worked for, all the things, all the people that you love are then focused on taking care of you. It doesn't make any sense. So
Yeah.
we have to focus on ourselves. And so that's all we want people, black men to do, is to focus on themselves, to give yourself and think long term. Hey, I'm going to be here. I'm going to be here for my kids. I'm going to watch my daughter walk down the aisle
Yeah.
because I am going to be here and healthy. I'm going to walk my daughter down the aisle. And I want to be able to be here and do it with both legs and all my senses.
There you go. There you go. Couple of things I want to do before we wrap up. I want to remind men that physicals are free and we can thank who, Clarence?
President Barack Obama.
There you go. There you
So
go.
yeah, one of the things that he was able to and he fought for in the Affordable Care Act, also known as Obamacare.
Yeah.
I don't call it that, but the
Mm.
Affordable Care Act was to make sure that that everybody's in the United States, if you have a health insurance plan, whether it's through your employer or if you get it through the Affordable Care Act, that your annual physical is absolutely free. There is no copay. There are no deductibles. It doesn't count toward anything. You just go. It is a way to get people to go. He saw that back in the early 2000s when he decided that that was going to be one of the pillars of his presidency, and he fought to keep that in there, and it's there. It costs nothing to go to see a doctor at least once a year.
Black Men's Health Alliance, four target areas that they're going to be focusing on. And of course, physical wellness is one, mental health, fitness, as well as nutrition. How is this free? That's the first question. And how do we reach out to you to get started? And are you already up and running?
So yes, so our website is there. So with lots of articles, more coming all the time, and so there's lots of knowledge base right now. We are building the community component of it. At this moment, the doors are open. Come on in.
Yay, good.
We'll talk. We'll see you next year. For we wanted to make sure that there was some skin in the game, so that you feel like you're getting something. It's $12 a year, $1 a month, that you're going to be able to have access to all of these professionals, all of this community. So we're not charging, and we probably won't until at the beginning of next quarter. But right
Mhm.
now, the doors are open. Come on in, become and join us as a member, and just take it in. We're going to bring on people who are bringing lots of knowledge, and it only takes one piece of knowledge to change your life. That's the
That's
most
it.
important thing.
That
One
is
thing can change your life. So come on and get it. Get this goodness.
bmhalliance.org, and that is the way to reach out. I got to tell you, this is a brilliant idea. It's a 501c3 nonprofit organization, the Black Men's Health Alliance. Clarence Reynolds and Dr. Brian Sykes, they're already waiting for you. Is it a weekly chat that you all have, daily, monthly, what?
Yeah, we're doing monthly right now. So you'll see all of those programs will have speakers and activities once a month. So the group coaching is monthly. So right now we're really going to bend to the community. Brian is he. It's so interesting. We see how we were raised differently. As a medical professional. He thinks of everything from an access point of view. So he's
Okay.
like, let's start this way, but we don't know how it's going to end. Our members are going to tell us how they want this to go. So
Okay.
we're open. Where if you say, "Hey, the coaching is great, but I need it every 2 weeks. I can't do it once a month. I can't wait for it." That's fine. We will facilitate that. So
Good.
we're going to leave this up to our community to really tell us how they want this to go.
With community initiatives, they've got challenges for you, solutions. It's going to be fun. There are going to be lively conversations. It's not going to be anything that's going to be long, boring, drawn out, anything like that. Again, hook up with them as soon as you can. Go to www.bmhalliance.org. Clarence Reynolds, thank you so much for being on with us this evening.
It is my pleasure. Thank you for having me, and thank you for helping me spread the word. And this is the genesis of something I hope will be a normal thing for all Black men,
Yeah.
sort of a rite of passage that you come through, you
Ah,
check out, and you get information that can actually change your life.
we appreciate you, Clarence. Thank you once again for evening with us. Remember to follow us on Facebook and please make sure to share this video. That's the way we get this information out. Subscribe to our YouTube channel at One Take Live. And again, we thank you for joining us on One Take Live with Monica May. We're also on Spotify. Have a wonderful rest of your evening.